Now we have 573 daily cases now, and we still wait and see . Hello everybody, this is Kriscell from Kristainment. I hope you have a wonderful day. So in my last video, right, I already stressed already, I'm very worried about the current COVID situation in Singapore because the number is shooting faster than rockets . And then as a parent, I'm also very worried because every day when I go out, either to work or to do my errands, I'm very scared. By the time I come home, right, will I bring the virus back to my children? And because of this concern, I go and search around. I am shocked. I actually found this piece of news. It was saying in today in Singapore, we have about 100 plus children that is hospitalized because of COVID-19. I know 100 plus not a very big number, but it's not very small also . Then the report also say, these 100 plus children very lucky . None of them is a serious case. None of them need oxygen. None of them need go ICU . Yes, very lucky. But then do we really want to wait until one of our children kena COVID-19 then go into ICU, need oxygen, then we start to worry, is it? By that time too late now. Plus now already 500 plus daily case count already. Shouldn't we all start to worry a bit or be a bit kiasu or kiasi lah? Singapore culture we should be kiasu and kiasi at least lah. I know a lot of uncle auntie like to go kopi tiam to la kopi with their kaki lah. But then we all must know okay. At this point of time the more you la kopi the more the number will go up then you also don't want, right? You la kopi, then because of that you bring home the virus to your grandchildren. Then like that, worth it or not?
We have a plan to reopen and live with the virus, and we knew all along, and we've said so before, that once we reopen and resume activities, we will experience a new wave of infection. All countries that open up have had to deal with such waves. For us, it is happening faster than we had expected. And it's also the first time since our opening that we are facing such a new exponential wave of infection in our community.
Yes, when we open up, numbers will sure go up. This one we all understand. But to say that, we never expect the number to go up exponentially, this one a little bit way gum lah. I know the MTF, they make decision, not just a few of them only. So behind them, right, got a group of experts one. And for all these experts, in order for them to advise the MTF correctly, they rely on a lot of data. So based on all these data, they will say that, based on all this, I think we can open this. I think we cannot open this. When we open this, we agak can get this number. We don't open this, we agak can save this amount of number. Then if you say that you never expect the numbers to go up exponentially, then it means that the data got something wrong already. Then can we just scrap out all this data, get a new set of data so that all these experts can reanalyze them again and then give a better advice or not?
Very soon we will reach 1,000 new cases a day, and in a few weeks' time we will probably get to 2,000 new cases a day. And that's why we have to take a more cautious approach in the current situation and make sure that we adjust quickly to this fluid and rapidly changing infection situation.
1,000 or 2,000 daily cases, I can tell you, judging for the current situation, we will hit it in a matter of weeks, especially if we're not doing anything. Yeah, I mean, remember that we also eased up quite a few of our measures because we believe that our high vaccination rate is giving us some level of protection. Which is true. I mean, it's true with the high vaccination rate, it does give us some level of protection. However, we also must know that the virus itself is evolving and is spreading among the community. If we don't do anything, now we are at 500. In a matter of days, At most, I'll give you 1 week. We will hit 1,000. Then in a couple of weeks' time, we will hit 2,000 already. This is doubling, exponential. Any person who knows some basic maths will know. If 2,000 we still don't do anything. What's the next number? 4,000. Are we going to wait until it becomes 4,000 then we do something? No, right? So the question here is like, what are we adjusting? What are we doing to manage this?
The difference between now and what we had, say, a few months ago or even last year is that we have a much higher vaccination rate and so better protection from the vaccines. And that's why we've said before that our focus is not just on the daily infection numbers, but the number of serious cases needing oxygen and ICU care.
You cannot say daily case count not important. I think in the current situation, having more numbers is better than less. So if the Jinghu can let the people know things like, or numbers like, for example, the daily case count, the daily number of unlinked case, the number of people who are in hospital, the number of people who need oxygen, the number of people who are in ICU, all these are very good numbers, because with all these numbers, general public, they can at least know how serious the situation is, or if it's okay, it's okay. If it's not okay, it's not okay. At least they can prepare themselves both physically and mentally. To be very frank, I really don't know why there's a need to change the format of reporting. I really don't know. The first version, I thought it's quite good already. Then they changed to one of a simplified version by taking away some of the numbers. I really don't know why we are so worried about sharing numbers. Is it because you worry that people might panic when they see some of the numbers spike? Okay, when numbers go up, cannot deny one, people will sure get a little bit worried. Like now, you show people 500, people will get worried. Like me, I get worried. But am I panicking? No, I'm not panicking. I'm just worried. And then I'm wondering what are we going to do to actually manage this? But it's better. It's a better situation. When we have all these numbers and for the public to actually see for themselves, then to have our PM Lee suddenly appear on TV with his magic cup and then tell us, hey, we are going to another phase 2 heightened alert, or another worst case circuit breaker with his magic cup. Okay, I know there's an ongoing debate between Ho Chin and Kelvin Chan on the unlinked cases reporting one. Okay, I'm not elite like them, that's why I don't know what they are thinking. Okay, but to me, if you have the unlinked cases numbers, then just share this number. Knowing more is always better than knowing less, especially in this current situation. Unless you are telling me the more you know, the more dangerous you are. Unless you are saying the more I know about this whole entire number of cases and things like that, the more the coronavirus will come and find me, then I don't want. But then that's not the case, be it you know more or you know less, if the coronavirus want to come and find you, still will come and find you. There's no escape one. So just let us know the information. Then if this one is also a request. In the WhatsApp message that we receive every morning now, if we can include one more piece of information, which is on the children, at least let us know how many children is being hospitalized because of COVID-19. That will, at least for parents like us, at least we see, now got this amount of children who are hospitalized. We can assess the situation. Now, because as of now, we really don't know unless we go and search to try to find out for ourselves. If not, we really don't know whether our children are really, really, really very safe, or there is still a risk one. If there is still a risk, then we better make sure we have precaution taken. As a parent, we want to protect our children. So I hope our Jinghu can understand this .
And indeed, that's our key focus. Our ICU numbers are still low now, as you heard just now, but we must not be complacent and assume this will automatically remain so over the coming weeks, because severe illness typically comes 2 weeks or more after one catches the virus. So we have to monitor the situation closely and also see and learn from the experiences in other countries. There are countries that are highly vaccinated, which have gone through a wave of infection, and they have kept their hospital system intact and avoided high death toll in their society. On the other hand, there are also countries with a highly vaccinated rate experiencing a wave of infection, and despite their best preparations, they have seen these cases, infection cases, follow through to more people needing oxygen and ICUs. Their hospital systems get overwhelmed, and eventually they see more people succumbing to the disease. Take Israel as an example. It's a highly vaccinated population. It's now going through a wave of infection. Cases have gone up sharply, and the ICU cases have also risen. And over the past week, they have seen an average of 25 deaths a day.
ICU numbers is stable. That is a good sign. At least it shows that our hospital is able to cope with the severe cases if it comes, okay? But the question that I want to ask is, do we have enough normal beds for those patients who are infected and needs to be hospitalized? Do we have enough beds for them? Okay, then for children especially, if the children are they kena COVID-19, okay, are we sure that KK has enough beds for all these children? I know now we are talking about self-recovery at home, but then, you know, for some of these children, we don't know now, okay, if they are so sick until they cannot self-recover at home, but they need to go hospital. We just want to make sure that, you know, we have enough hospital beds for them. You know, the worst thing that can happen is that we run out of normal beds. Are we doing enough to prepare for the influx? Are we ready? Or are we going to be in a situation like Israel like that? I mean, it's always good to reference other countries so that we can learn where they have done well, and then we avoid where they have failed. However, always know that we are dealing with coronavirus, you know, and with this, there's always this element of uncertainty. So things like, for example, the rate at which the virus is spreading, this is unknown to us. We don't know how fast suddenly it will spread so fast, and suddenly it spread very slow. This one we don't know. Then second is the lead time until the symptoms kick in. And then when the symptoms kick in, well, will it trigger to a mild symptom or to a severe case? We really don't know. So all these uncertainty will add up together.
And that's why we are asking everyone to exercise restraint during this period. Scale back your non-essential social activities, get tested regularly, and let's all do our part to try and slow down the spread of the virus. I should add that throughout this pandemic, our actions have been guided by data and evidence and based on the advice of our medical and scientific experts.
Since our Zhenghu is not going to implement any more tighter measures other than no social gathering at the workplace, which to be very frank, until today, I just scratch my head exactly how useful that will be. But anyway, that's not the key thing. Okay, what the key thing here is because the Zhenghu is not implementing any tighter measures, okay, people are now self-adopting some tighter measures. Like for example, some of them actually start to dabao or call for food delivery instead of dining in. Then some of them also try to stay at home as much as they can and try to limit their social activity. Some even work from home, even though our Zhenghu never say work from home as default. In fact, I must say, because our Zhenghu never say work from home as default, some company actually insisted that their staff actually return back to the office, you know.
And the collective view of the MTF and our experts is this. First, we do not think there is a need to return to the heightened alert and circuit breaker at this juncture. As I said on Monday, these are last resort measures and we should not rule them out entirely. In the event that we see the risk of our hospital system being overwhelmed, we may have to introduce them. But at this point, we do not see a need to return to the heightened alert or to the circuit breaker. Second, we also do not think it would be prudent to press ahead with any opening measures during this period, especially when we are in the midst of an exponential rise in infection cases. In fact, that would be a reckless thing to do under current circumstances. So thirdly, our position is we believe it is more prudent to take a pause now, do our best to slow down the spread where we can, and then monitor closely what happens to our ICU situation over the next 2 to 4 weeks.
It is okay if Jinghu don't want to go to another phase 2 heightened alert or to another circuit breaker. But then allow at least allow people to actually practice some self-tightening measures without suffering any penalty Okay, I got example for this is that people want to work from home because they felt that at this current situation it's not safe to commute. They try to commute less. Then they also try to have less physical interaction with their colleagues at work. So they choose to work from home. But then because Jinghu never say that now is work from home as default. So some company actually insisted to have their staff to actually come back to the office. So if the Jinghu can you don't want to go phase 2 don't want to go circuit breaker, it's fine. But at least allow employees or people who wants to work from home an option to work from home without suffering any penalty. And the empowerment to this option should be given to the employees, so that they can choose for themselves whether is it safe enough for them to actually travel to the office or they want to continue to work from home. Of course now cannot open out already. Now we have 500 plus daily case count. Any opening like what Lawrence Wong say is not only risky, it's also damn stupid, damn dumb. Even a 5-year-old can say already, now it's not safe already. Don't do anything now. If you ask me now, the last safety net we should do now, the worst case thing that we should do now is don't do anything. Take a pause and monitor. That is okay. But we must know the virus is not taking a pause. Every minute, every second we spend taking a pause and monitor, the virus is evolving and spreading. Judging from the current situation, the biggest cluster that we have now is actually the bus interchange clusters. And from what I can observe, likely is due to because the bus captain during their break time, they come together to have some chit chat then maybe lim kopi or la kopi that's why or maybe during their meal time, their lunch time or their dinner time, they actually come together in the canteen and then with their mask off so a suggestion that I will have is that maybe we can adopt something like in the phase 2 heightened alert, which is to actually no dine-in for public. Then for all the frontliners, including our bus captains, they still can dine in because that's their work. Then but then they have to dine alone and strictly there's no interaction between each another. So with this, then maybe we can actually help to reduce the cluster numbers.
And meanwhile, we continue to take several important measures. First, as you heard just now, adjusting our healthcare protocols to cope with the surge in cases, to ensure we have sufficient capacity in our hospitals to take care of all the serious cases that may emerge in the coming days and weeks. Second, for all of us to do our part to exercise restraint and moderation and scale back on our non-essential social activities, especially for our seniors and for those who are living with seniors. Third, step up regular widespread testing with distributed test kits to every household. We are in the midst of distributing them and we will be starting that process for employers as well. So let's all get into the habit of being tested regularly. It's a very effective way of detecting cases quickly so that we can slow down the spread of transmission in the community.
I will say don't just beef up the capacity to handle the serious case, but also must beef up the capacity for the normal case, because you never know, the normal case can then escalate into serious case and if that comes if we are not prepared, right, we might be overwhelmed. Then we will hit a situation whereby there is no bed at all in the hospital. I think many of us have already scaled back on our social activities. In fact, some of us have not even seen our relatives and friends for ages already, and we miss those physical face-to-face interaction, like for example, 打麻将, sing karaoke and things like that. But then, for their own safety and for our safety, no choice, we just have to tahan a bit. Testing is very important. But like I said in my previous video, right, okay, it is a post-static. It's a post-static. So unless the current test kits that we have today are able to detect the virus upon we kena the infection, right, else how effective, right, or how useful testing will be, there will be a limit to it.
And finally, we will continue with all our efforts to roll out vaccinations to those who are still unvaccinated, especially our seniors, and we will proceed with our booster program for those 60 and above quite soon. We know that this is an uncertain and difficult time for all of us, but as we have done over the past 20 months, tackling and fighting this virus, we will be able to overcome this wave of infection by continuing to work together and stand together.
Vaccination is good. Okay, we have a lot of data to actually show that people who are vaccinated show mild or no symptom at all. Okay, but then I think the vaccination story we need to tone down a little bit. I felt that we have oversold the vaccination story already. Yes, vaccination provide protection. However, we all know that this protection is not 100%. And because it is not 100%, all it takes is just one vaccinated person, fully vaccinated person, to actually die from coronavirus, and it will burst the balloon. And when this balloon bursts, people will start to ask, people will start to question, what is the point of taking a COVID vaccine? Alright, that's it for this video. So if you love this video, please remember to share. If you like it, please give it a big thumbs up, okay? Give it a big thumbs up. And if you're new to my channel, like I always say, don't be paiseh, go and click the subscribe button, okay? It's very easy one, just click the subscribe button. Click one time can, don't click 2 times later, you will unsubscribe, okay? And if you see the bell button, okay, please go and click it, okay? So that you'll be notified of any new videos that I'll be doing. So till my next video, okay, please stay safe and wear a mask when you go out, okay? And this is Kriscell, signing off.